Talking about how Google and YouTube can be useful as an ophthalmologist. So, no financial interest. So, even though we used digital learning platform before, but the COVID pandemic brought the true potential light to it, and it certainly propelled digital learning to the forefront of, and it helped to the forefront of ophthalmology training. So, it has four broad categories. We have web-based learning, virtual examination and artificial intelligence, virtual mentorship and video-based learning. So how is it helpful? Definitely yes, because each individual has different way of learning things, and he prefers his own learning skills. So learners have control over the content, learning sequence, pace of learning, and time. So maybe one individual has a keen interest on some topic, so he can concentrate on that topic whenever he has free time. So and it also integrate when the contents are integrated with video and photos, so it becomes the experience is different. So it allows them to tailor their experience to meet personal learning objective. So what all we have in web-based learning? So we have numerous journals and articles, case scenarios, questionnaires, and it serves as an alternative to in-person teaching, promotes a self-motivated problem-solving based approach, and it also provides latest information, and it's easily accessible and with one touch in your mobile or through your laptop. So what the student usually should do? So actually the student should prepare for the class beforehand. So students prepare and participate in class activities before they prepare the notes, and then they go to the class, they discuss with their mentor or other colleagues, and they get concepts from them. So and after coming back to home, so they apply their concepts, and he'll understand how much, till what extent he has learned. Okay. And there are various platforms. You have AIO cyber site, which provides catalogs like self-study material free of cost. You can access these multiple websites which are available. And virtual examination and artificial intelligence has case-based interactive tests. So artificial intelligence and feedback system identifies mistakes, and it stresses upon the mistakes which you have made, and it will concentrate on where you are going wrong. So that portion is stressed upon. So this is another very important tool. This is Global Education Network for Retinopathy of Prematurity, and they have this website was developed by various ophthalmologists around the world, and they have developed IROP, that is artificial intelligence, that utilizes an automated vascular severity score to measure disease severity. So here is one example of this module. So they give pictures of babies, like pupillary dilatation, anti-segment examination, and fundus examination in all the four quadrants. With this, after that, they give data of birth weight, PMA, gestational age, and then you have to grade it according to the severity. So once you grade this, so it will tell you whether it's right or wrong. So different parameters are there, and once you hit the submit button, it will tell you that everything is correct or wrong. Suppose if a person goes wrong in this test, so the artificial intelligence identifies the mistake, and it'll express in such a way that you understand where you have gone wrong, and it will point out the mistake with the picture, and it gives data around about the image. Apart from that, you have one more module called as iTelligen. So same way what I showed in ROP, this has data about how the grading of NPDR and PDR. So it has various parameters, and a postgraduate or a fellow can go through the images, and he has to tick mark the all these parameters, and based on that, whether it will give us whether it's correct or wrong. So it had been piloted among US and Canadian ophthalmology trainees before, and they demonstrated significant improvement in trainees' diagnostic approach after the participation in program. But now it is easily accessible to all, I would request all the trainees, fellows, and postgraduates to go through these websites for the better learning. So machine mentoring, again, artificial intelligence and machine learning are used to train learners how to identify the pathology, whether to treat or whether to refer. In one more important category, that is video-based learning. What are the benefits of video-based learning? So it's always the learner will be engaged if it's very interactive and educational video, and it helps in understanding the complex concepts. So experiential learning, and it has what seeing is believing. So there is longer retention and most economical learning. Just you can type the whatever the surgeries are you interested in, you just type, you get it in one go, and it is easily accessible. So most of them have smartphones, so it is easily accessible. And previously, what we used to do, suppose in AIOS itself, 10 years or 15 years down the lane, 10 years or 15 years before, if I had to attend 2 talks which was coinciding with the time, I had to sacrifice 1 talk. But now it's not like that. Say suppose Dr. K.S. Kumar talk if I missed last year, I can go back in the evening hours and just play the talk, and I can get the inputs from that talk. In the same way, most of the conferences provide online access to the talks and discussions. Subsequently, for the larger number of audience, and many of the institutes have built a very good online library, and which you can access on YouTube. And there are other open retina quiz which were conducted. So it's a very powerful tool for the learners. And this is also even the surgeries. Say suppose 20 years back, I still remember my father getting VCRs and DVDs to learn cataracts, or to see whether the complications, any input from the conference. So it was space consuming, time consuming. But now there are so many surgeries. Like you name a step of complication, you get some 10 to 15 surgeries. So this is very important for the beginners. So they have to go through each and every step at a time. So again, take-home messages are web-based learning has its own advantages, and it's here to stay for longer time. And virtual meetings and examination can help when travel is not possible. It can be easily used for easing the learning curve and reduce complications by seeing the surgical videos. Telesurgery may not be a far-fetched dream. It might come in near future. But from this, the drawbacks are it's not a replacement to traditional learning, but it complements it to form blended learning. Again, asthenopic symptoms, dry eye are the other disadvantages for the longer screen time. It requires gadgets. Again, high-end gadgets provide better advantage. And there are a lot of distractions. Say suppose if you want to watch a 5-minute surgical video, and on the right-hand corner, if you see Shah Rukh Khan's trailer or something, you end up clicking that, and you keep wasting time. So such things should not happen. And programs have sometimes failed to meet the expectations, and it's still a long way to go. Maybe by next 5 years, you'll have great modules. Thank you.
Thank you very much, Mathan. You covered the topic very well. The essence was, for those of you who are in the audience as postgraduates, try to make the most of what is available on the web. There is a whole plethora of videos and knowledge-based learning platforms hidden there. It's for you to explore and exploit. That was what Mathan Joshi was trying to highlight. And when presented with an opportunity to operate, you should be willing to take the cudgels and go ahead with it after having watched all the videos that are available. You must imagine as if you are operating after watching those videos, and then be ready when the situation presents itself.